Sarah, a young woman with blonde hair and blue eyes, sits pondering her future. She looks at her reflection in the mirror and sees the tears strolling down her pale face. She steps in the shower, knowing what her future holds. She reaches for the brown intertwined cord and places it gently around her neck, signifying a loss to this battle. Peggy, the grandma, stumbles upon Sarah and calls 911. The ambulance sirens gets louder and louder as it gets closer to the house. Peggy sits in shock, not knowing what the outcome will be. The paramedics rush Sarah to the hospital, doing what they can to save her. Peggy is left sitting, waiting, and praying for the unknown. The American College Health Association states that in the spring of 2015, 18.3% of students reported in the last 12 months that they felt so overwhelmed by everything they had to do. This is referring to being stressed out, and according to the Journal of Child and Adolescent Psychiatric Nursing, prolonged stress can lead to depression. This is just kind of determining the difference between people feeling anxiety versus depression. Anxiety is you think you're going to fail a test, or you did fail a test, so you're just feeling so anxious about it. Depression is you actually are starting to feel hopeless from anxiety building up so long. After personally experiencing, researching, and interviewing the impact of depression, I feel that this topic is important for students to be informed of due to the impact it can have on someone's life. In this speech, I would like to share the signs and symptoms of depression and how depression affects your family and friends. Then I want to move into the different ways to solve depression. Let me first talk about the signs and symptoms of depression and how depression affects your family and friends. According to Julie Lehman, the Heston College campus counselor, there are many signs and symptoms of depression. One symptom is that you have a loss of interest in things that you love to do. An example of this could be someone that loves to play softball, doesn't want to go to practice anymore. Another way is people like to isolate themselves by staying in their rooms, keeping out of contact with family and friends. They have a disturbance of sleep, whether this means sleeping too much or not sleeping enough. And lastly, they start to withdraw. To me, this is your outcome on life, just you don't care what your outcome on life is. All these symptoms become noticeable to your family and friends, and according to Robert T. Mueller, who has a PhD, he states it's extremely hard on your family and friends because they can't see or feel the force behind the suffering. When it's hard for your family or friends to help you if you don't express what your feelings are. Now that we've talked about the signs and symptoms of depression and how it affects family and friends, let's move into the different ways to help solve depression. According to Madeline R. Vaughn, there are many negative ways to deal with depression. Alcohol is one of the main ones because it's found in most social settings. The use of drug and painkillers to cope with depression is another big one. The problem with this is that it masks your problem, but it doesn't treat the underlying problem. This also can lead to dependency in that substance. Another negative way is suicidal ideation, which is the thought and plan to kill yourself. This is a permanent solution to a solvable problem. Now, some positive ways to treat depression is talking about your feelings and taking medication and trying to balance out the levels in the brain. According to Kevin Wilder, a Heston College faculty member who has a psychology degree, people who are clinically depressed tend to do better when taking medication in combination with going to therapy. In an article from the American Family Physician, cognitive therapy is a treatment process that enables patients to correct false self-beliefs that can lead to negative moods and behaviors. The assumption is that a thought precedes a mood. Therefore, by substituting your negative thoughts with healthy thoughts, then it should help increase your mood, your self-concept, your behavior, and your physical state overall. As I've just explained, depression is something that is vital to watch for. I have explained the signs and symptoms and how it affects your family and friends, and also the different ways to solve depression. As someone who has dealt with a family member who suffered from depression and chose to take her own life, then battling my own depression, I am determined to make others aware of this mental disorder to help others from dealing with the pain I've had to deal with. I hope that this speech will better teach you to observe and pay attention to your family and friends and your own feelings, and the mood changes that people go through to prevent a tragic event from happening.